Again. At this time, we'll call to order the Board of County Commissioners meeting for the purpose of a committee of the whole to receive information from the medical examiner's office. Will the clerk please call the roll?
Commissioner Fast is in the building.
She's in the building.
Commissioner Myers.
Myers here.
Commissioner O'Hara. Here. Commissioner Hanslick.
Hanslick here.
Commissioner Ashcraft.
Here, sorry, you caught me mid-swallow.
Commissioner Allenbrand.
Brand I.
And Chairman Eilert.
Here. We do have a quorum present, so at this time, I'll turn it over to Mr. Connor.
Good afternoon, Chairman and Commissioners. Joe Connor, Assistant County Manager. I'm here today with Dr. Diane Peterson, who is our Chief Medical Examiner, and Charlie Hunt, our Deputy Director of Department of Health and Environment. And, so what we want to try to accomplish today are just a few things. One is,
Just for clarification, the medical examiner's office is under the Public Health Department, is that right?
That's correct.
Yes.
Correct.
Yes, okay, thank you.
so goals for today are really to provide some education on the duties and responsibilities that the medical examiner and the coroner has in Kansas. Dr. Peterson's been with us now for over 2 years, and it's been a little while since we've had an update on the operations, and it has changed dramatically from the former coroner system to what we have today. So this is a good opportunity to provide that update. And then talk a little bit about the organizational and operational overview for the medical examiner's office. Dr. Peterson has gone through a few iterations of what the organizational chart looks like. We'll talk about what it is today and some of the challenges that she's starting to face. And then talk about the summary of their activities. So there's performance measures in here. There's levels of activity that happen in the medical examiner's office that are nowhere close to what it used to be when it was under the coroner system. So good information to share there. And I want to spend a little bit of time talking about their staffing challenges. I know that many of the departments have come, before you talking about staffing challenges, and Dr. Peterson's operation is no different. On their investigator side, as a matter of fact, they've had a couple of changes in the last 5 or 6 weeks. One happened on Tuesday, and she's had to notify some of our partners that they've had to pull back on some of their services because they're lacking the staff to provide at the level that they were before. So, she'll talk a little bit more about that, but we have some immediate challenges, and again, we had a person leave us on Tuesday that's really exacerbating the problem. So that's kind of our goals for the session, and I'll turn it over to Dr. Peterson. I'm going to go through the rest of the slides.
Okay, thank you. Dr. Peterson?
Thank you. Before I start, I just want to do a
Could you
brief
pull the microphone
overview.
a little closer? Thank you.
Is that better?
Yes, ma'am.
Before I start, just a brief overview of the statutes that cover our office. So everything that we do is statutorily driven, and it's in our state statutes of Chapter 22A, Article 2, specifically talking about district coroners and outlines all the responsibilities of a coroner. In the state of Kansas, to be a coroner, you have to be a physician, but you can be any kind of physician. The coroner before me was an emergency room physician. And what that typically means for the rest of the state is that those physicians have to hire out for autopsies because they cannot do autopsies themselves. They're not trained to do autopsies. And so that was where we were at before the medical examiner's office opened. We contracted out for autopsy services. I am a forensic pathologist, which makes me a medical examiner, as well as a coroner. And part of my training is to do autopsies, so I do the autopsies myself. A lot of the questions frequently are what types of death get reported to the medical examiner, and that is also statutorily required. There are certain categories of death that are required to be reported to the coroner. Not all of them are suicides, overdoses. A lot of them are actually natural as well. We deal with a lot of natural causes of death, either in those individuals who were previously healthy and now have suddenly passed, children, or if they just simply don't have a physician. You cannot pass away without a physician. I become that physician to sign the death certificate if you don't have a physician in life. So it's not all just the things that you see on TV. And you'll also see the last on the list is deaths due to diseases or causes of a public interest. So COVID, by state law, COVID deaths are required to be reported to my office because they are deaths due to a public interest. The state law also outlines and states that it is up to the coroner ME whether a death investigation takes place at all. So it's not up to law enforcement, it's not up to the DA. It is actually the coroner's responsibility to decide if a death investigation takes place. And that investigation can include medical records, law enforcement reports, or all the way up to a full autopsy. When we started in 2019, we developed a vision and a mission for our office. Slide 6 shows us our vision that we developed, and you can read it there. I won't read it to you. And then we have several aspects of our mission as well. Part of our mission is timely service. We also wanted to do our service at the high quality of the National Association of Medical Examiners, which will be our accrediting body. And we also work very closely with multiple different interested parties, primarily law enforcement, but not exclusively law enforcement. We work very closely with funeral homes, hospitals, hospice agencies, nursing homes, obviously the families. There's a lot of interested parties that we deal with multiple times a day, every day. Other part of our mission is to conduct thorough, independent investigations. We communicate with every family of every death where we're assuming jurisdiction. When I say assume jurisdiction, what I mean is we are assuming the responsibility of the death certificate. If I say decline jurisdiction, that means that we are declining the responsibility of the death certificate and allowing the private physician to sign the death certificate. We want to do our work with the latest forensic pathology knowledge, toxicology services, and do it in an unbiased manner. We also are a resource of information. My office does a lot of education, and in fact, education is a lot of the reason why we're at today. We have taken a lot of time educating hospice agencies, hospitals, law enforcement, EMS, fire, many, many different people in the region as well as across the state on proper death investigation. And then, we also do collect data on deaths and report those as required. But part of our mission also is to provide a work environment where we want to retain high-quality staff. And right now, that's a lot of where our issue is. Moving on to slide 11, before May 2019, so I began in January 2019. In May of 2019, that was when we very first started doing scene investigations. So we would go out to the scene where a death occurred. Prior to that, reports of death from whether it was law enforcement on a scene or a hospital would go through the Sheriff's Division Court Security. Court Security would call the coroner on call and report the death to them. The coroner would say, yes, we accept jurisdiction, no, we decline. Nobody would be going to the scene from the coroner's office. Very, very rarely would a homicide scene be attended by a member of the coroner's office, but that was unusual. Usually there was nobody on scene except for law enforcement. And some of the reports of death were faxed directly to our autopsy service provider. So at this time, I was not doing autopsies yet. We didn't have the building. We still had the contract for the autopsy service provider. Slide 12 shows, again, I started in January. I hired my chief investigator in April. And when I came on, what I was told of estimates of caseload, so this is estimates of what we were expected to have for work essentially, was about 300 exams a year. So about 300 autopsies, external exams combined a year. Looking back at the data in 2015, 2017 that I had access to, we were averaging at that time about 23 autopsies a month, a little over 300 exams total per year. When I came on, there was no discussion about reports of death. It was simply, the entire discussion was around autopsies, and this is how many autopsies you have, and that's it. So in 2019, we were basically allotted 6 part-time, under 20-hour, on-call, no benefit investigator positions. And that's what we started with at the end of 2019. And we did staff those positions and started there. We moved into our building in May of 2020 and then began doing autopsies in our building in August of 2020. So from there, our type of work changed and our workload changed. We do have several divisions in our office: investigations, obviously, autopsy, toxicology, the physicians. So there's 2 of us physicians. We are both forensic pathologists. We are both triple boarded in anatomic, clinical, and forensic pathology. And then we do have administrative staff as well. Today, I'm going to be focusing on the investigations division and not any of the other divisions. It is the investigations division that is our most urgent need of attention. And so on slide 14, now we are highlighting we're getting into our workload, our current workload as it stands. The investigators in our office basically touch in one way or another, spend time on in one way or another, every single death that's reported to our office, whether it's reported through a fax report or a phone call from a hospital or law enforcement, or it's reported to us by a funeral home. Sometimes funeral homes report a death to us. They all get time from an investigator to look at the death, look at the report. If it's a faxed report, read it. Does it sound like it's natural? Is there a doctor willing to sign the death certificate? If so, enter it into the database and be done. It can be as little as 30 minutes. However, it can be many, many hours if there's a scene response that's required. In 2021, we had 2,775 deaths reported to our office, much higher than 300. That equals almost a little over 7.5 cases per day. And keep in mind, we are a 24/7 operation. So this is holidays, this is weekends, this is middle of the night. So far this year, we are averaging about the same. Right now, we're averaging about 7.4 cases per day. Scene responses continue to increase. In 2021, we went to over 600 death scenes, averaging about 1.7 a day. To date, this year, we are averaging close to 2 a day. So our scene responses are going up. And that includes a change in our scene response. So due to our recent staffing challenges, I've had to make 2 separate decisions to change our scene response. Initially, beginning in September, I made the decision not to go out to declined jurisdiction natural death scenes. And this week, I made the decision that we are now going only out to homicide and suspicious scenes on the weekends when I have staff on call. And it's because of the on-call aspect of it. During the week, I'm able to have staff in-house. And so with that on-call, we are changing our scene response right now. Average scene time can vary anywhere from 1 to 2 hours all the way up to 4, 6, multiple hours. It just depends on the type of scene. And I think I will get into later the issues with not going out to a scene. Each case that we accept jurisdiction for, so this is a case where we are signing the death certificate, so we have to do sufficient investigation to figure out the cause of death, requires multiple hours of work on the part of the investigators. They always call family on every single case to outline our procedures, expected timelines, what we need from the family, what they can expect from us, and answer any questions. We always request records as needed if they went to the hospital, et cetera. We have also had an increase this last couple of years in individuals who pass away in Johnson County who either have no family or their family is not known. And so it takes us time, days sometimes, to do the searching of databases and the phone calls to try to find family, to reconnect family with their loved one, and to allow the family to choose a funeral home. If we cannot identify any family, then the individual becomes what we call a county cremation, and the county pays for the person to be cremated. All of that work in locating families is done by investigators. So given that we are getting reported nearly 2,800 cases per year and all of these hours of work that are done, it's affecting our quality. We're not able to do the retrospective quality assurance that we had been doing previously. It delays interviews and it delays completion of investigator reports, which then delays everything else from there on. Slide 16 shows us our caseload trends. The colors are years. 2022 is as of October 13th. And I just want to draw your attention to the total cases. That means total deaths reported to our office. And I've starred the 2019 because the 2018 and 2019 numbers, that's coming from the database from our contracted autopsy service provider. And they had a little over 700 cases in 2019 within their database. Court Security had in their system that we got reported 900 deaths. However, that is still 3 times less than where we're at now. We have had a dramatic increase in the number of deaths reported to our office under the ME system as compared to under the coroner system. And that is entirely because of our education. That is because I went out and I spoke to every single hospice agency, every single hospice, hospital, every single law enforcement agency, fire, EMS, and reminded them of the statutes, reminded them of the types of death that are required by law to be reported to the coroner ME. And what that means is that we were missing many, many cases under the coroner system. Scene responses is highlighted there. Total exams, so exams are both autopsy as well as simply external examinations. So a myth frequently is that if you come into the ME office, you're automatically getting an autopsy. That is not true. It is up to the individual physician of the level of examination. You can either get simply an external examination, an examination of the outside of the body, or both an external and an internal, which is the autopsy. And as you can see, even our examinations are increasing. Record reviews, those are cases where we sign the death certificate based off of medical records only. We do not bring the person into our office for an examination. We simply order medical records. And slide 17 highlights the manners of death. This is frequently what's asked of our office are the manners of death. That is a key interest of many people. And as you can see in slide 17, as I mentioned previously, natural causes of death are among the higher of our time, in addition to accident and suicide and the other manners of death. And I will point out, suicides are up. They are not down this year. They are up, and they continue to go up. As Joe mentioned, we do have performance indicators. We do have goals for our office, and that is highlighted in slide 18. The majority of our key performance indicators are those that are set by our accrediting body name, National Association of Medical Examiners. The majority of those indicators come from our requirements for accreditation. So coming from a department of one when I started, you can now see our chart on slide 19 of where we're at now. We have my chief investigator as well as 4 investigator positions, and then an investigator administrator who basically does not go out to scenes, simply does the essentially desk work of an investigator, takes the phone calls, takes reports of death, talks to families, gather medical records, etc. We also do have toxicology staff, as I mentioned, autopsy technicians who help the physicians in the autopsy suite, and then admin staff. So, as I mentioned, when we first started, we started with an on-call staffing model. And over the last 3 years, we have found that the on-call staffing model is not sustainable. It is not working. As I've already mentioned, we did all this education. Our caseload has increased. And what we've noticed is that, and it continues to happen today, we're not done educating. We still have more education to do because there are still deaths that are getting signed out that are injury-related deaths that are not getting reported to our office. So there's still more education needed to be done. However, in addition to caseload, we also do have to think about geography. So at this time, we only have 1 investigator on at any given time for the majority of the shifts, for the majority of the week. Since I only have 4 full-time investigators plus my chief, and I have a 24/7 operation, if you think about it, that only leaves about 1. And so geography plays a role as well. And we'll go into that in a slide here later. Our caseload really does require some dedicated staff hours. What we have found with the on-call and our short staff is that basically life is unpredictable, and it leads to limited sleep, potential safety concerns. It also affects our business. We can't release individuals to a funeral home on the weekends because we're only on call on the weekends, which means I don't have staff in-house to release a person to the funeral home. We limit the activities of the staff while they're on call to limit the number of hours that they are actively working. Slide 22 is a complicated slide, but I want to bring your attention to basically the red boxed numbers. What we're seeing in these graphs are the colors are shifts, so midnights, days, evenings, and then we have the days of the week. And what we're looking at are the total number of deaths reported for that whole year in that shift on that day. And as you can see in 2020, we maxed out at about 140, but now here in 2022 already, and we're not even done having any Mondays or Thursdays or Fridays, and we're already up to 200. And that's total Mondays per shift for the whole entire year. Yes, ma'am.
Well, let's go ahead and finish the presentation, then we'll come back.
It is just Johnson County. All of this data that I'm providing, yes, just Johnson County.
Okay,
Yes.
continue, please.
So this slide is outdated. Slide 23 is outdated. I do have one vacancy. We did partner with County Manager's Office and have an innovation team look at our operation and provide feedback. As part of that analysis, they interviewed each and every one of my team members, and they, at that time, that was mid this year, several of my investigators were at high risk of leaving, and certainly one of those has come to fruition. Most of the complaints have been from the continual changes in schedule, because when one person is sick, one person is on vacation, that drastically changes things for everybody else. At the bottom of slide 23 is the current schedule as of October 13th, when I wrote this slide, before the change in schedule due to the vacancy that just happened. As you can see, most shifts and most days, we only have one investigator on at a time. Wednesday is our day of overlap, and the weekends are on call.
Okay,
We have had several instances where we are not able to abide by one of our key performance indicators, which is that we respond to a scene, make it out to a scene in less than 45 minutes. And this is the example that I spoke of when it comes to geography. Recently, we had a very complicated traffic fatality that was a 4-hour response. We were out on scene for 4 hours. That was in Shawnee. While we were on scene in Shawnee, we got reports of death in Olathe and Overland Park. Those are not geographically close to each other by any means. And at the end of the day, we didn't make it to Olathe and Overland Park. We had to rely on law enforcement for those scenes and get law enforcement's information, photographs, et cetera, for those scenes. At the end of the day, one investigator per shift is not sufficient. And having multiple scenes at once in multiple locations in the county happens. If you think back to that shift totals graph, there's no way that we can attend 200, those are reports of death. Now, granted, not all of those are scenes, but if you think about it, 200 in one shift on any given day, given that we only have so many Mondays in a year, you're going to have overlap. It's going to happen. We have made some changes for investigators. We established an overtime budget line. When I started, we did not have a line item in our budget for overtime. We have initiated a shift differential, on-call pay, callback pay. We've done some spot bonuses, retention bonuses. We've, of course, have the levels. But at the end of the day, pay does not keep staff. When their lives are consistently changed because they have to cover for somebody that's out on vacation or somebody that's sick, that is more important than pay. So my future plans for investigators is outlined on slide 26. And the innovations team recommended, and it's simply based off of the hours and days in the week. It has nothing to do with caseload, that we need a total of 10 investigators just to cover the hours in the day. And this excludes the chief investigator so that she can do quality assurance and her supervisorial activities as required. The previous models that we started with were all based on caseload. So what we are doing now is we are staffing based off of the hours in the day and not caseload. And by doing that, it helps handle the caseload. My plan is to allow a progression. So I will implement level 3s and lead investigators, as well as deputy chief investigator. One of the very common complaints here, as well as nationwide, are stagnant positions. People want the ability to move up. And so we have developed with HR a progression plan for additional responsibilities, but to get there, you have to have time served and certifications, et cetera, that you have to achieve before you can get there. Immediate steps is an IAR. So we did have the 3 part-time investigator positions approved within the budget. My request is to make those full-time and add 3 more. And this was presented to the PRC, who also recommended that as well. Alternatively, could be 2 separate IARs, the first being changing those 3 part-time to full-time now, and early 2023, adding those extra 3 to get up to basically the total of 10 as recommended by the innovation team to cover a 24/7 operation. Just to highlight a comparable jurisdiction, comparable population, caseload, et cetera, out of South Carolina, they match basically where we're going and what was recommended for a 24/7 operation. Just the last 2 slides are speaking of revenue. Slide 29 tells you overview of our current revenue sources. We do sign cremation permits. To be cremated in the state of Kansas requires permission from the local coroner. And so Dr. James and I sign every cremation permit for Johnson County, and we do gather revenue for that. We also do get reimbursed for child autopsies through the state. That is a state statute that those get reimbursed to the coroner. If there is civil litigation, we pathologists do charge for our time. We are currently serving Reno County, and then there is other minor revenue. In the future, potential revenue source ideas, potential to provide autopsy services to additional counties, and we've discussed that before in this room, as well as potential to provide toxicology testing services to other areas, other coroners, when we get our toxicology lab up and running.
Well, Dr. Peterson, the information you presented certainly verifies that prior to establishing your office, the level of services that we were able to offer with an independent contractor just wasn't enough. And so thank you for that information. Let me ask you, in the case of a law enforcement issue, law enforcement has their own ability to investigate a situation. If there's an unknown reason for the death, do you get called? Or if there is, let's say, a shooting where an individual is killed by a shooting, do you still have to investigate that situation?
Yes. Yes, absolutely. So law enforcement calls us for every death because it's not law enforcement that determines the cause of death or whether or not, what the manner of death would be. So is this a homicide? Is it a suicide? Law enforcement certainly assists with the investigation, the scene investigation. We perform interviews together. In the case of suicide, interviews of the families, et cetera. So they call us on all of them.
Okay.
And so even if it's a shooting, we will go out and investigate to verify the initial reports of this is a suicide, this is a homicide.
Okay. And let me ask you this. I don't recall, in the 23 budget, have you asked for additional personnel? Or was it part of the 23 budget?
Yes, the 3 part-time investigator positions were part of the 23 budget.
Okay.
Yes.
So you're asking us to consider an early hiring, is that right?
Early hire as well as conversion to full-time.
Okay. All right. Thank you. Question, Ms. Fast.
Yeah, I guess, You know, the rate of growth is really unsustainable in terms of us being able to meet that need. But I also wonder, you know, what I'm hearing from hospice social workers is that, well, now you can call the Johnson County Medical Examiner and they'll do an autopsy. And so it's a want, not a need. And you said you were doing a lot of natural deaths. And so that concerns me. I don't see us as that role, that we should be providing an autopsy, you know, for every concerned family. I think, you know, your intake criteria, I'm wondering if it's obvious you expanded it way much more wider than our previous coroner. And so I think that needs to be looked at. What is our role and who we are serving on taxpayers' money?
Okay, so point of clarification, we are not autopsying unnecessarily. So the hospice agencies that report natural causes of death to us, we have let them basically decide how many of the naturals that they report to us. We have told them you have to report the non-naturals to us. It's required by state law. If some hospice agencies have chosen, instead of to have their own staff figure out the nuances, and it's not always obvious, there are nuances, to whether it's a natural or a non-natural. Some of them have chosen just to report them all, let us figure out the nuances. Is it natural? Is it non-natural? But that doesn't mean we autopsy. So we actually don't really autopsy hospice patients ever.
How many natural deaths are you doing, though?
So that's the point of clarification. So just because a person dies of a natural cause of death doesn't mean it was, number one, expected, or number two, that we knew which natural cause of death it was when they passed away. For example, if a person has shortness of breath and passes away, that could be asthma, that could be a blood clot to the lungs, that could be a heart attack. We don't know which natural that was. We do the autopsy, we figure out which natural it was. The doctor's not willing to sign because they don't know what it was without that autopsy. That is a legitimate need and a legitimate service to answer that question for the family. It's also for the public good to understand what natural disease caused the death. And so those are legitimate.
Families paid for that, and taxpayers are now paying for that. That's part of this huge rate increase.
So we will, if a natural cause of death is understood and known and there are no other competing causes of death, we will attempt to decline jurisdiction. If a doctor is willing to sign the death certificate, then we are declining, and that's the end of our responsibility. If the family wants an autopsy on a case where we are declining jurisdiction, we will recommend them for a private autopsy, and we are not doing any private autopsies. So the autopsies that we do are public interest only autopsies. We are not doing it simply because the family wants to know exactly why they died.
But you've broadened the definition from our previous coroner, which is why our numbers have gone way up. I mean, I've worked in child abuse and how you intake it. You know, if you have a broader intake, the state can intake a lot of children, and if you have a more narrow intake, so you broadened the intake criteria, is that correct?
I did not broaden the intake criteria. I broadened the knowledge of what needs to be reported to us. We were missing injury-related deaths before we did the education. We are still not getting some of those reported. The importance of getting reported more rather than fewer is we miss fewer of those non-natural deaths. And that has huge implications for the family financially. If a physician puts a natural cause of death on a death certificate, but it was actually fall-related, injury-related, that family is out double indemnity accidental life insurance because the injury is not listed on the death certificate. It is important for families that more cases are reported to us so that we can catch those ones that the hospital, hospice, whomever thought this is natural. We don't need to do anything else for it. But they are wrong, and it's actually non-natural. And so that has huge implications for the family. So I hear you in that you think that,
Stats, you know,
Right.
of who you're serving and who we used to serve. And,
Right.
And what cases are we serving now that are different than we previously did in
Let's-
2017?
Let's keep this in mind. We were contracting with a private service in
Correct.
another county. That entity also had contracts with other entities for the same level of service. So to a certain extent, our requests for service were limited to the ability that this private contractor had to provide the service. And that was one of the reasons that we decided to propose and go ahead with our own medical examiner's office. So I think we need to understand, comparing our service today to what we had previously really is not comparable because of our reliance upon a private contractor who had other contracts with other entities. So
Yeah, I've worked in the front lines with that contractor, so
Yeah.
anybody who knows, I do.
yeah, well, I know, so that's, it's, the expansion of the service that we've been able to offer with the medical examiner's office is appropriate. And it just points out the deficiencies that we had in our prior operation. Mr. Ashcraft?
Well, a follow-on to Commissioner Fast's question, and I think you said this, but, and I think it's a valid point. What I understood you were saying or asking is that you're looking for comparable metrics between how it was defined in the prior evolution to today because of the fear that we may be inflating the numbers unfairly or inaccurately. And Dr. Peterson is suggesting that it's not, but I think it's a fair question, and I'd like to have a better understanding of that too, because it does look like a huge increase. And the question then is, that huge increase, it provides a service at a certain level, but is it having an impact on the clearance of crimes or the well-being of individuals who are in long-term care facilities because you're being more attentive and cutting down on abuse? And I'm not trying to be flippant at that, but that service, just for doing the service, has a value, but it's not necessarily as impactful as impacting crime or abuse or neglect, those kind of things. So I'd like to.
Yeah, I mean, if this is, every year we're going to be funding more and more, I mean, I think there's going to need to be policy decisions. What is our goal?
We are at.
Need to be
our goal.
careful. This office was provided in order to do the necessary requirements of state statutes. And that's a key factor in providing the necessary service for the community. So, I congratulate you for doing that. Mr. Myers?
Thank you, Chair. So what I'm hearing is that cases have been on the rise for several reasons, but one of the main reasons is because people are now following what they should have been following before. And that's real important. I think that's the biggest issue. I want to make sure none of our cases or none of our scene responses are outside of Johnson County.
Correct, none.
And so the only county that we're doing work for in any fashion is Reno County.
Correct, and that's just autopsy services.
And are we having other counties knocking at our door asking?
Yes.
And so, again, that's what opens the can of worms when we provide, and you hate to not provide help for people that can't help themselves, but I don't know how you operate this way. So I see a lot of, it's all justified in my mind for the, what you're asking. I want to see it getting taken care of as quickly as possible. This is such an important service to our constituents, and Johnson County should be the leader and do it the right way. And it seems like there are situations that are arising where we're not doing things the right way. And I could understand as an employee, I would not want to be part of that situation of not feeling like I'm doing things that need to be done the way they should be done. And I don't think your requests are unreasonable. It becomes, can we and how do we get the job done?
Ms. Hensley?
Thank you. First of all, Dr. Peterson, I want to commend you and your staff for thinking differently in terms of, rather than staffing for cases, to staff basically 24/7. Having operated a 24/7 facility myself, you can't, there's no way to guess when you're going to need people or how many. So I commend you for that, and I very much understand that strategy to make sure that you're covered. From my own experience at Safe Home, having had to make use of previous coroner services and dealing with that system, I'm kind of looking at it from the user side, and when you're in those kind of situations, waiting for information or waiting for a response is agonizing. And let alone the need for law enforcement to have the information right away. So I appreciate your bringing this to our attention, and I'm kind of mulling it over through my own lens of knowing that feeling of what may seem an hour, maybe it's an hour delay, seems like a million years for someone who's waiting for someone to show up and help with that situation. So
Absolutely.
I appreciate it.
Ms. O'Hara?
Thank you, Mr. Chair. So the crime scene investigations, prior to you stepping up into this role, how is this handled?
So there's a distinction between crime scene investigations and death scene investigations. They are not the same. So the sheriff's office has, within the crime lab, crime scene investigators. They do crime scenes. They only go out to certain scenes that we might also be at. They go to scenes that we are not at because there's not a fatality. So crime scene investigations and death scene investigations is not the same. However, so with death scene investigations, before my office, they did not exist. There was no death scene investigation. There was no person from the coroner's office at any death scene, very rarely at maybe a homicide or two.
So the sheriff's department or the police department, they stepped in and filled that?
Correct.
Okay, so they did the death scene investigation. So it wasn't like that no investigation was done. It was done by the police department or the sheriff's department.
Correct. And so keep in mind that their duty out on scene is to determine, did a crime occur, and if so, who did it? Their purpose is not to determine the cause of death. It's also not to determine the manner of death. That is entirely up to the coroner signing the death certificate. So the quality of a death scene investigation for those purposes was not where it needed to be because that's not their area of expertise. That's not what they trained to do.
So prior to you coming on board, we were depending on the police departments and the sheriff's departments.
Correct.
Okay, and so now, is this a duplication of services? I mean, are they doing an investigation and then you're doing an investigation?
No, it is not duplication. Again, back to, we are out there for different purposes. We are out there looking for different things. So if we are on scene together, and the majority of our scenes has no crime scene response, crime scene investigation response. Law enforcement might be there, but crime scene investigators are not there for the majority of our scenes. When we are out on scene, we are looking for things that will help us with next of kin identification, identification of the decedent, cause of death, manner of death. Those are all things that they are not necessarily out there looking for. We will, and the statutes that apply to us allow us to do a lot more without a search warrant than what they are allowed to do without a search warrant.
So is our level of services, is that duplicated in Sedgwick County or Shawnee County and the other counties within Wyandotte County? I mean, how do the counties that, the urban counties, how are they approaching this?
So Sedgwick County has a medical examiner's office as well, and they have their own death scene investigators that go out to a death scene just like we do. Shawnee County is under the same provider as what we used to contract with, and they don't do death scene investigations. Wyandotte County uses that same autopsy contract provider, and they don't do scene investigations in Wyandotte County. So the counties with medical examiner's offices, Sedgwick and Johnson, have death scene investigators that go out to the death scene. That is the typical model nationwide for medical examiners' offices, to have scene investigators, death investigators, to go out to the scene and investigate the death.
So is Wyandotte County and Shawnee County adhering to state statutes?
They are adhering to state statutes because they have a coroner. Yes.
Okay, all right. So adopting the medical examiner's model then expanded the requirements under state statutes for Johnson County. Is that correct?
It expanded the services and the type of death investigation and the extensiveness of the death investigation. It basically brought it up to nationwide standards.
And how many investigators does Sedgwick County have?
I do not know.
Okay.
I think it's good to keep in mind a crime scene. Law enforcement has one area of responsibility. The coroner's office, medical examiner's office has another area of responsibility. So they might both be on the scene, but they're accomplishing different things. I would also ask commissioners to keep in mind, we ask voters to approve a 1/4-cent sales tax, which paid for the courthouse as well as the medical examiner's office. So the voters agreed to make that commitment. And in part of the process, it was explained what the activities of the medical examiner's office would be. And I think we have a responsibility to carry out what the taxpayers have paid for, and to fall short in that responsibility would bother me a great deal. Other questions, Ms. Allenbrand?
Thank you, Mr. Chairman. I really want to applaud you for the work you've done, because I've had several incidences in my district. One was I think there was a suicide, or I can't remember the suicide, I remember, but your staff was out on that call, and it took it took a lot of time, and then somebody else, and I remember talking to this gentleman, and he lost his wife, and to have the sheriff's department was upset. He was upset because they're in that home waiting, and that's a long time. So to make those changes is important. And then again, like you said, I've known families where they felt like the death had happened by a fall or some other, and it was never investigated, and that is a lot of money. And previously, it took a long time, and I know some of that was also state, but you've turned things around very quickly. And when you're waiting, and you lose a husband, which I have a friend that she lost her husband and they had young children and they had to wait over 6 months, you know, to get that death certificate, and they had no income. So it's very important. I really appreciate. I'm not getting the complaints and calls that I got before.
Thank you.
Dr. Peterson, would you once again state your recommendation for additional personnel?
Yes. And while he's pulling that up, I will say we do get a lot of praise from families, but we also get the praise from the law enforcement agencies. Even just this last week, when we were out on a scene, we got a follow-up email. They appreciate that we're out there doing these services so that they don't have to do it anymore. They don't have to worry about it. They don't have to think about it, because again, this is not what they were trained to do. This is what we are trained to do, and so they appreciate it as well. Chairman, the recommendation, my request is to change the 3 part-time positions that were approved in the 2023 budget to become 6 full-time investigator positions.
So you would be adding 3, am I hearing you correctly?
Correct.
The 3 part-time would go to full-time plus 3 additional.
Correct.
Okay, all right. And when will that be advanced, Mr. Connor?
Agenda review next week.
We've got a briefing sheet that we are waiting on feedback from this session. We're shooting for October 27th agenda review.
Okay, thank you. Mr. Myers?
And so I'm trying to think of possible solutions, money-wise. Where are we at as far as opioid monies coming to the county? What is a update on that situation?
Maury Thompson, Deputy County Manager. We have received only one payment to date of about $115,000, I believe.
But
Anticipating more and any day, quite frankly, but that's it so far.
That be dedicated to this?
well, I mean, it could be.
That's only one-time monies. That
Right,
don't
no.
really do anything.
But I mean, I'm talking about for immediate response. Something needs to be done, or we're going to lose more personnel is what I'm worried about. Retaining the personnel we have becomes urgent in my mind.
Mr. Thompson, let me ask you this. It was my understanding of reading somewhere that these opioid payments would continue over a long period of time. Is that right?
That's correct.
I mean, for years.
For years. Yeah, I think the reference I've seen, Chairman, is something like 24, 25 years anticipated. Again, some uncertainty about what we'll eventually receive, but it'll be several $1 million, I would anticipate.
Okay. Mr. Ashcraft?
Thank you, Mr. Chairman. Mr. Myers, I understand your anxiousness, but I think the challenge is she needs staff, not money, and money will pay for staff, but it's the time element of getting staff on board, which at best would take months, unless you've got people already pre-selected, and that's the challenge.
Well, but you've got 3 that would go to full-time instead of part-time,
Correct,
Yeah.
correct.
which would help.
Yeah, but I appreciate your presentation. You did a very good job. I do have a number of questions, though, so before, well, I guess next week it's on agenda review. Maybe we could visit in depth on that.
I am having surgery on Tuesday. I won't be here next week.
Well, Mr. Connors will be, so
Yeah.
I'm sure he'll be glad to visit you in the hospital after he and I talk.
There'll be a follow-up surgery for me after I visit with you.
Other questions, Ms. Fast?
Yeah, so I guess, this is coming forth, the DA's office. I mean, every week, we voted for
A budget.
merit increases, we voted for class, we voted for, we did substantial, workforce. And I know there's a workforce crisis, but I guess not every week, and then every time it's out of the reserves. I'm just this is really concerning me. I just feel like we need then to have some sort of plan. I mean, mental health needs it, corrections, it's like whoever comes to you, then you say yes, and they come forward. You know what I mean? But I know all these other agencies, department directors too, are in crisis. So I'm concerned about this weekly sort of, certain department directors get to
Well,
come forward.
let's talk about that a little bit. We have 3 new district court judges that have been assigned to our district court. That requires additional personnel, and we have a responsibility to provide that.
And that's out of our control that we got 3 new
Pardon?
judges. That part is out of our control that we get 3 new judges. And I will share in your concern, because I think, that there are a lot of departments that are waiting till the budget process. And then there are departments, in running a business this complex, we can't always wait till the budget process. There is an issue here that she's raising that needs to be addressed. I think it would be foolish for us not to bring it forward and bring it to your attention and find out the policy choice that you want to make. There are options. There's an alternative here. I'm not sure it's the best one, but there is an option that she didn't get a chance to highlight as kind of a hybrid scenario. But when there's needs, and you can't always wait till the budget time. I'm concerned as well. The sheriff brought forward a concern. That was a need that needed to be addressed. That, again, I think you guys agreed with the policy choice because you approved it. But that was a need with the level of vacancies that were happening at the department for public safety that we couldn't wait on. And we are under a salary survey right now, and you'll find out the rest of the needs for the organization, and we'll put together the best strategy we can in leading up to the budget, unless there's something more urgent that we need to bring in the meantime. I get that the budget is the ideal time to address all the budget issues, but the day-to-day businesses and needs don't operate that cleanly. And I think you deserve to know when there are needs, when there are staff issues to the level that people are leaving us. And it's this important business. We can't ignore it. We need to bring it forward and talk about options. I am looking over at Scott, because we talk every day about the budget concerns, because this is the actions that we are taking. If you take action with this one, the DA's office that is on the agenda review for today and action next week, the sheriff's office that you talked about, others may pop up.
Do you know of other ones that are coming forth?
Well, there are things that come on my desk every day, and there's a lot of things that we say it has to wait. So we'll bring them forward as soon as we feel like they're ready, or if it's urgent and it pops up. So I share your concern, and I think this next budget will be challenging because we're starting in a position of kind of being where we're going to have to look for resources or cuts.
I guess I just would like to stress that she has cut back on service levels twice in a month because of personnel issues. That's not going to get any better. And so to me, I understand what you're saying, Commissioner Fast. These things come forward quite often and you feel that way, but we're bringing this one forward because service levels have been cut.
Yeah.
And so I just think we have a responsibility to bring it forward. If it's something that we don't want to move forward with, that's great, but we wanted to just make sure and let you know that that's significant changes in her operation twice in the last month.
And if we don't take a responsible action, then you lose the 3-part time, probably.
Yeah.
It's ultimately a policy choice for the board when we bring things forward.
Yeah, okay. Any other question, Ms. Allenbrand?
Thank you, Mr. Chair. So I share the same concerns, but I think we need to do this because she needs to have it. So I'm assuming, because I don't know what the dollar amount is, either that or I overlooked it. So I'm wondering, I know that was one of the questions I had on the DA, what's the dollar amount? And then are we actively looking is Scott and his team, are they actually, because we've got a lot of stuff and we probably are going to have to do some cuts.
Right.
In 2023, we're going to have to do some serious, and I think we all know that.
Right.
But,
Yeah, it's like, I've been in office now almost, 8 years city council, I'm going on my 4th. There's nothing harder than you approve additional staff, and then the next year you have to cut those staff. And, I've been through that, and you have too. And that's what I just do not want to have to do that with departments of having layoffs. That's the worst thing ever.
Well, we did make it through a recession because we have healthy reserves, and this is part of the reason why we have a triple and able to maintain a triple AAA bond rating, is that not only do you have adequate reserves within what the rating agencies look at which is in our policies and our goals, but we also have shown that this organization can make the tough choices, like we did during the pandemic, and we had to cut 25,000 or 25 million within a matter of weeks. We did that through the recession. We didn't have layoffs. I came from an organization halfway through the recession that were doing layoffs. I came here, and that was different. Both organizations downsized because of the economy at the time, but they did it differently. Here, I was proud that we didn't use layoffs to get to that. We made the cuts over 4 years. We were able to make the cuts over 4 years because we have had adequate reserves to buy us time to get there. I share the concern that these actions are costing us money, and knowing, budget office is keeping track of these. They know what's coming to the budget that we're about to start this next process on, and we'll have collectively some tough choices to make in the upcoming budget. We'll have to look at the revenue and expense side.
Mr. Ashcraft.
Thank you, Mr. Chairman. A follow-on to Commissioner Fast's comment, and I may understand it a little differently, so I apologize if I mischaracterize it. There seem to be two issues here, and one is potential or feared staff turnover, the impact on staff, and that's real. I would say, though, and I commend you for the actions you've taken to modify, or as Mr. Connors says, cut services. But the question that I think Commissioner Fast is getting at is this modification of service. It's real, but what are the impact on the outcomes of the people that we're trying to serve? And it may be in here, but I haven't seen it, so I'd like to learn more about that.
I think that was spoken to, but anyway, it doesn't hurt to ask questions, get more information.
Chairman, this is Penny. I wanted one question that got asked that wasn't answered, and if you were done with that, I didn't mean to.
I'm good.
Commissioner Allenbrand asked the question of the fiscal impact. They have that information. I just received it as well. I don't know if it's complete, but that was what was going to go into the briefing sheet. However, if you have that information, let's go ahead and share that.
Yeah, for the 6 investigators, it's slightly over $500,000 in salary and benefits for 6 people.
Okay, all right.
So just to follow up on my question I had, thank you, Mr. Chairman, I should have put my hand up. I feel confident that the staff is working on this, and coming from the healthcare industry and from hospital industry, we would have up and downs. Never could we ever cut staff, but there was always somewhere that it would come from. So I feel confident that the staff is working on that, and we are going to have some tough decisions in 2023, so. Thank you.
I would simply refer to the recent announcement at KU Health and the Latham Medical Center. That's an unusual step, I would say, but it's necessary, and they're interested in providing their current high level of service also. So, well, Dr. Peterson, thank you very much, and no action is required today. We will have your request on agenda review for next week. Is that correct, Mr. Connor?
That's correct.
Okay, all right. If there are no other questions, why, we are adjourned. Thank you all very much.
Thank you.
Time, really
Thank you,
appreciate
Mr.
it.
Chair.
Mr.